Hello and welcome. Today we're diving deep into a critical topic: renal cell carcinoma, also known as kidney cancer. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. This is a complex disease, but we'll break it down to make it easier to understand. So, what exactly causes renal cell carcinoma? The truth is, the exact cause is often unknown. However, several factors can significantly increase your risk. These include smoking, obesity, high blood pressure, and long-term dialysis treatment. Certain genetic conditions, like von Hippel-Lindau disease, Birt-Hogg-Dubé syndrome, and hereditary papillary renal cell carcinoma, also play a role. Exposure to certain substances like cadmium and trichloroethylene can also contribute to the development of renal cell carcinoma. It's important to remember that having these risk factors doesn't guarantee you'll develop kidney cancer, but they do increase your chances. Now let's delve into the pathophysiology, or how renal cell carcinoma develops in the body. It all starts with mutations in the DNA of kidney cells. These mutations cause the cells to grow and divide uncontrollably, forming a tumor. This tumor can then invade nearby tissues and organs. Perhaps even more concerning, these cancerous cells can break away from the primary tumor and spread to distant parts of the body through the bloodstream or lymphatic system, a process called metastasis. The most common sites of metastasis include the lungs, bones, liver, and brain. Different genetic mutations and molecular pathways are involved in different types of renal cell carcinoma, influencing their growth patterns and responses to treatment. Let's talk about how common renal cell carcinoma actually is. It's estimated that around 73,000 new cases are diagnosed in the United States each year. It accounts for approximately 2–3% of all cancers in adults. Men are about twice as likely to develop renal cell carcinoma as women. The average age at diagnosis is around 64, but it can occur in younger individuals, especially those with inherited genetic mutations. While it's not considered a highly prevalent cancer, its impact is significant, underscoring the importance of awareness and early detection. What are the signs and symptoms to watch out for? In its early stages, renal cell carcinoma often causes no symptoms, making early detection challenging. However, as the tumor grows, symptoms may develop. These can include blood in the urine, persistent pain in the side or back, a lump or mass in the abdomen, unexplained weight loss, fatigue, loss of appetite, and persistent fever that isn't related to an infection. In some cases, renal cell carcinoma can cause anemia or high blood pressure. It's important to note that these symptoms can also be caused by other conditions, but if you experience any of them, it's crucial to see a doctor for evaluation. Diagnosis of renal cell carcinoma typically involves a combination of physical exams, imaging tests, and biopsies. Your doctor will likely start with a physical exam and review your medical history. Imaging tests such as CT scans, MRIs, and ultrasounds are used to visualize the kidneys and identify any tumors. A biopsy, where a small sample of tissue is removed and examined under a microscope, is usually necessary to confirm the diagnosis of renal cell carcinoma and determine its type and grade. Blood and urine tests can also provide valuable information about kidney function and overall health. Molecular testing of the tumor tissue may be performed to identify specific genetic mutations that can guide treatment decisions. Renal cell carcinoma isn't a single disease, it has different subtypes. The most common type is clear cell renal cell carcinoma, accounting for about 78% of cases. Other types include papillary renal cell carcinoma, chromophobe renal cell carcinoma, collecting duct renal cell carcinoma, and unclassified renal cell carcinoma. These subtypes differ in their genetic makeup, growth patterns, and response to treatment. Accurate classification is essential for determining the most appropriate treatment strategy. The TM staging system, tumor node. Metastasis is used to classify the extent of the cancer, from stage I, a small, localized tumor, to stage IV, as cancer has spread to distant sites. The treatment and management of renal cell carcinoma depend on several factors, including the stage and grade of the cancer, the patient's overall health, and their preferences. Treatment options include surgery, targeted therapy, immunotherapy, radiation therapy, and active surveillance. Surgery, specifically a nephrectomy, a partial or complete removal of the kidney, is often the primary treatment for localized renal cell carcinoma. Targeted therapies, such as tyrosine kinase inhibitors and mTOR inhibitors, block specific molecules involved in cancer cell growth and survival. Immunotherapy, which boosts the body's immune system to fight cancer, has shown remarkable success in treating advanced renal cell carcinoma. Radiation therapy may be used to shrink tumors or relieve symptoms. Active surveillance, which involves closely monitoring the tumor without immediate treatment, may be an option for small, slow-growing tumors in patients who are not good candidates for surgery. A multidisciplinary approach involving oncologists, surgeons, and other specialists is often necessary to provide the best possible care. While there's no guaranteed way to prevent renal cell carcinoma, you can take steps to reduce your risk. Quitting smoking is crucial. Maintaining a healthy weight, controlling high blood pressure, and avoiding exposure to harmful chemicals can also help. If you have a family history of kidney cancer or a genetic condition that increases your risk, talk to your doctor about screening options. Regular checkups and awareness of potential symptoms are key to early detection and timely intervention. The prognosis for renal cell carcinoma varies widely depending on the stage at diagnosis, the type of cancer, and the patient's overall health. Early detection and treatment significantly improve the chances of survival. For patients with localized renal cell carcinoma that is completely removed by surgery, the 5-year survival rate is high. However, the prognosis is less favorable for patients with advanced or metastatic disease. Ongoing research is leading to new and improved treatments for renal cell carcinoma. Recent advances include the development of novel targeted therapies and immunotherapies, as well as the identification of new genetic markers that can predict treatment response. Clinical trials are constantly exploring new ways to diagnose, treat, and prevent renal cell carcinoma, offering hope for improved outcomes in the future. Thank you for joining us on this journey to understand renal cell carcinoma. Remember, early detection and a proactive approach are key in managing this disease.